Good morning, everyone. Welcome to the COVID-19 media briefing. I'm Carrie Schutte, the Public Information Officer for the Shasta County Health and Human Services Agency. We'll start with the numbers, and as of Monday, we have 5,132 cases, including 93 from Monday. We have done a total of 90,409 tests. We have an estimated 432 people in isolation and another 62 who are hospitalized, including 10 of whom who are in the intensive care unit. And we have 50 people who have died of COVID. Today with us, we have Robin Schurig. She's the director of the Public Health Branch of the Shasta County Health and Human Services Agency. We have Dr. Karen Ramstrom. She is our health officer. Matt Pontus is the CEO of Shasta County. We've got Robert Folden from Mercy Medical Center, Redding, and Mark Mitchelson from Shasta Regional Medical Center. And that looks like everybody we've got today. Do any of you have anything to start us off with before we go to media questions?
I did. Good morning, everybody. So I just wanted to let you all know today that we have been doing a lot of planning the state level and locally around COVID-19 vaccine. And it's very, very promising. We're excited about the findings of these clinical trials to date. And the process is continuing at the national level for approval. There was a meeting of the Advisory Committee of Immunization Practices yesterday, and they made some final determinations about some of the initial priority groups. And then on the 10th of December, the FDA will be meeting to review both the Pfizer and the Moderna vaccine clinical trial findings to make decisions about their approval. Followed by, again, the ACIP will meet a second time to talk about guidelines if those are approved. And so all of that's in the works at the national level, and simultaneously a lot of work going on planning the state to enroll facilities to order vaccine. There's some pre-positioned locations for vaccine, including at Mercy Medical Center, Redding, which we are very appreciative of them taking on that role. And so we will have some pre-positioned vaccine ready for us. So when the approval goes through, we'll be ready to make that available to our healthcare workers and our skilled nursing facilities. So all of that's in the works, and we're very, very excited and hopeful about this next stage in our response to this pandemic. And we'll continue to keep you updated as we learn more and are interested to see what the findings are when they're reviewed, both at the national level and at the state level by our scientific review committee that's also going to independently review the findings from these clinical trials to ensure that we are also comfortable with the efficacy and safety findings on these vaccines before making them available to California residents. So more to come, and happy to answer questions around that.
All right, thanks, Dr. Ramstrom. Anybody else? Okay.
So I just wanted to take a moment. Last week we spoke about changes that we made inside the hospital to accommodate the number of COVID patients that we were seeing. And I wanted to take a minute today to just talk about the staff side, because we're pulling our staff in directions they've never been pulled before. And we're caring for a disease process, while similar to others, it's different and it's new and sometimes it's scary. But I got to tell you, I'm impressed every day at how our staff has been able to step up and sort of rise to the occasion. So whether it's the nurse that's on the floor, or the physicians caring for the patient, or the EVS tech cleaning the room, or the engineer that is modifying the environment to accommodate the environment that we need, our staff has risen to the occasion over and over and over. So knowing that we had additional work that we did over the holiday weekend, and knowing that there were a lot of people on this call that were involved in work over the weekend, I just wanted to say thank you to our staff, thank you to you. Thanks to Region 3 EMS for the support that we've continued to receive. It's while it's a busy time, it really is a thankful time for many things. So there's a lot of things going well, even though we continue to see a lot of activity in the community. So I wanted to start with that today.
Well said, thank you. Anybody else? Okay, we are ready for media questions.
Well, I've got a question for Robin probably, or maybe Dr. Ramstrom. I spent a very enjoyable time at the Garden of Lights over the weekend with lots and lots of other people, some wearing masks, many not wearing masks, pretty difficult to social distance in a lot of places. Is there any concern about this Garden of Lights and having any kind of an outbreak connected to that?
Robin, I don't know
So
if
oh, I'm sorry, go ahead, Carrie.
we've been in touch with Turtle Bay. I don't know if you guys are in the loop on that, but our business engagement team, we've been in contact with Turtle Bay, and they had a great COVID safe plan in place. And sometimes we don't know how these things are going to look until they happen in real life. And so they are working right now to revise the way that they're doing some of their things there right now so that they can make it COVID safe. They were very quick to respond to some public feedback that they received about people being nervous about being in that close of a space with so many people. So they're working on that right now to get it fixed up.
Thank you, Carrie.
The media question.
Hi, good morning. This is Anna here from Channel 12. Just wanted to talk a little bit, we've seen a lot of state mandates that have come out, and, a lot of public law enforcement have said they just don't have the resources or the time to enforce these mandates. From public health's perspective, how do you guys feel about law enforcement not being able to step in, for example, like with the curfews and the masks?
Yeah, so I addressed this a little bit last week too, but I just would remind everyone that there is enforcement happening at the state level. There are state agencies who are enforcing the business requirements associated with, the Blueprint for a Safer Economy and the modified stay-at-home order. And as far as individuals, yes, it's understandable that law enforcement doesn't have time to be monitoring whether every individual person in the community is wearing a mask when they're supposed to be. And so we would just ask individuals to take that responsibility on themselves and wear a mask because it's going to protect your fellow community members and not because you're afraid of, getting a fine or a ticket or something.
Thanks for that, Robin. I just want to kind of follow up on that. You did mention that while there is no local enforcement on the local level, but from the state level, but as public health who works closely with our state, with our local agencies here, is that kind of frustrating at least?
I would say that we're just focused on our role as public health and the work that we do. And, law enforcement can decide what their role is. It's not really for us to tell them. And so we're fortunate that there is enforcement activity at the state level so that, businesses aren't just doing whatever they want to and ignoring the rules with no consequences. But I'm not going to speak to my feelings about local law enforcement's activities. That's sort of their job to decide what to do and what not to do. And we're going to focus on public health efforts.
Great. And then just kind of to follow up on that too. So, while the local law enforcement can't, do the enforcement, will public health still remain with that, educational approach to help businesses get into compliance?
Absolutely. We have a team that's dedicated to engaging with businesses and helping them either when we receive complaints about a business that's not doing the things that they're supposed to be, or when businesses reach out to us themselves for assistance. And so we're happy to help businesses understand the guidance that's in place for their particular sector and make recommendations on how they can meet those requirements.
Perfect. And then just kind of switch gears a little bit. I know the testing kicked off this week. It started yesterday. How has the testing been going at the new sites, and have the traveling teams started yet?
Yeah, so the new fixed site at the Boggs Building on Breslauer started yesterday, and so that is going well. And the other sites are starting on various days throughout this week. So we're starting at the Enterprise Regional Office today, and then there will be more locations opening up on the weekend. And as I mentioned previously, the scheduling for all of those is in the same location on the lhi.care website, which you can also get to from our shastaready.org website. And so, yeah, it's going smoothly. We're getting the logistical hiccups worked out of, getting new sites set up, but those are up and running.
You mentioned hiccups. Were there any problems yesterday getting with the fixed site at the Boggs Building up and running?
My understanding is that they got a little bit of a later start than they anticipated. So there were some people who had morning appointments who had to either reschedule, or if they wanted to wait, they could wait. And many people did that because they got started at around 10:30, I believe it was. And they were planning to start earlier than that, but it was just because it's a brand new site, getting everything set up, making sure that they have their signage up so that people know where to enter and exit and all of those kinds of logistical things.
Perfect, thank you. And then I had another question here. Yesterday, Public Health mentioned in the latest update that the agency is expecting an increase from Thanksgiving. We saw a similar pattern to that on Halloween. Are there any thoughts on that with a possibility of uptick in cases from Thanksgiving?
Yeah, I think anytime that there is an increase in people either traveling out of the area or getting together with family and friends, then there's an increased risk of disease transmission. And so we expect to see an uptick within the next week or two. We just don't really have a good sense of how many people sort of hunkered down and stayed home and stayed away from other people versus how many people did their normal Thanksgiving thing, getting together with others. So we'll have to wait and see how that pans out.
And as Public Health kind of waits for those numbers to come in the coming weeks, is there a concern when we see this happening? Because we did see this happen on Halloween.
Yeah, there's always a concern when we're anticipating an increase in cases. And as we've discussed before, as our cases go up, so do our hospitalizations and ultimately our deaths. And so there's absolutely a concern. And that's why we want to continue to encourage people to rethink their holiday plans, with Christmas and New Year's coming around the corner. Just going onto our website and reading the guidelines about modifications that you can make to your celebrations, and really just the basics of staying at home, staying away from other people. Call your family on the phone instead of getting together with them in person. Or if you do get together, try to do it outdoors, try to keep it as short as possible, those kinds of things.
Hi there, this is Matt Brannon from the Record Searchlight newspaper in Reading, and I had a question about what the county is hoping will kick in to sort of slow down these new infections. When is the county relying on to do that? Because I know that in the past, for limiting the spread, we talked about moving into the purple tier, enforcement from state agencies, and education, and those things continue to happen, but the numbers are still going up, and I wonder, what are we counting on to get those numbers lower at this point? Is it just hoping people start to take them more seriously?
Yeah, I would say that we're really relying on the community to, take this opportunity with vaccines coming around the corner, and, that sort of hopeful message of we're going to be out of this situation sooner than later, but this is not the time to be, out gathering and not wearing your mask and things like that. So we really need people to take this seriously and kind of hunker down for this holiday season and try to slow the increase in numbers until we can get the vaccine out to the general population.
So do we think that the purple tier is going to be enough to sort of maintain? Is that where we're going to stay, or do we think we'll add more restrictions? Do we think either from the local level here at the county or maybe through Governor Newsom adding more shutdowns? Do we think anything will change to limit the amount of activity in the community?
So there has been talk at the state level about potential for more of a stay-at-home order, especially in regions that are seeing high numbers, not only of cases, but of hospitalizations, and a limit in their capacity in terms of hospital beds and ICU beds. And so we'll have to see what that looks like. We don't have any specifics yet of what the state might do in our region or when. But yeah, I mean, I think really the more restrictions that are put in place, not everyone is going to follow them and take them seriously, but I think that the more things that are put in place, then the more people kind of think about, oh, this is really a big deal and we're really not in a good situation right now. Maybe I should think about doing more than I've been doing.
Gotcha. Okay. And then I also wondered, I saw a press release that hinted that there might be, with the amount of cases, that it's hard to do contact tracing nowadays. Do we have enough contact tracers to inform people who are exposed within, a reasonable amount of time? I've heard stories of people not getting informed that they've been exposed for a few days or up to a week or more. And do we know what the delay is for contact tracing right now? And do we need more tracers?
So definitely, I think more contact tracers is always good. The problem is that we can't just put somebody in that role and have them start working. There's training that's required. And so when we have a sudden uptick in our cases, we aren't able to do the same level of case investigation and contact tracing right away as we have been doing. So we have put some processes in place where we're prioritizing cases. And so if someone is a healthcare worker or if they live in a congregate setting or those kinds of high risk categories, then they will get a phone call from the case investigator, but otherwise they may only get a text letting them know that they've tested positive and that they need to self-isolate. And then through the text system, this is connected to the state's contact tracing system that we are using. There is a series of survey questions that they're asked that basically accomplishes the case investigation without having a staff person have to be on the phone with them. So we do have some modifications like that we've put into place. And sometimes as we're getting those new processes up and running, there is a little bit of a delay.
Gotcha. Okay. So about how many contact tracers does the county have right now?
I don't have a number off the top of my head. I know we just trained a new batch of contact tracers within the last few weeks. So I'm not sure how many of them are kind of up and running and operational, but I would guess probably 40 or so tools would be an estimate.
Yeah,
Gotcha.
I also, if I could just weigh in, we're also in a position where we have pretty good capacity, but at the same time, the numbers in our community are so high right now that we cannot and contact every case. And so we're using the other modalities that Robin had mentioned to do our best to reach out to everybody. But it's really important for anybody who tests to isolate themselves at home, do what they can to include isolating from their family members in the household, and to notify their close contacts. And we have information at shastaready.org on what that all involves. And we've been talking about it for quite a while. And we really would hope that the public would look at that educational information that comes either from the testing site or you can find otherwise online, including at Shasta Ready, and make sure that you're isolating yourself so you're not exposing other people, and notifying your close contacts that they have potentially been exposed. We are in a position right now where we cannot contain ourselves out of this pandemic. We can't do that. Public health can't do this alone. So we're really having to prioritize our public health experts to focus on really vulnerable settings and use technology, as Robin described, to do outreach to other cases in the community. And so we really need the community's help at this time to take that on and self-isolate and identify your close contacts.
Thank you for that answer. I appreciate that. I also wanted to ask, do we know what the latest breakdown is and where cases are coming from? Are more coming from hospitals, restaurants, schools, retail? Do we have an idea of where our cases are coming from now? Beyond just gathering.
Beyond just what was that?
Sorry, beyond just gatherings. I know that word gets used a lot, but I don't know. In a sense, it can be a little vague sometimes. So, yeah, that's what I was wondering.
Yeah, so I think we're seeing the cases coming from the same places that they've been coming from all along, just more in every category. So some of it is gatherings, getting together with family and friends. Some of it is people who've had contact with a confirmed case. So whether it's a household member or somebody that they work with or that they got together and had lunch with or something like that. It's a variety of things. And then I think it's important to remember too, that for many of the cases, we don't really know where they got it from because maybe they've been to several different places and they're not sure and they're not aware of anybody who was sick, who they were around. So it's really just out there in the community now, and anybody you come in contact with is at risk of having it and spreading it to you and vice versa.
Gotcha. Thank you.
I'd like to,
Mike, you can go ahead. You can go ahead.
real quickly, I would like to circle back to the testing. Do we know with the new fixed site and the traveling team, what kind of an impact that will have? Can you quantify that in terms of either numbers of people or shortening the time it takes to get a test?
Yeah, so with these added resources, it will triple the capacity that the Shasta College site had previously. So each of the sites, so Shasta College that continues to operate, as well as the new fixed site at the Boggs Building on Breslau, and then the traveling team that goes around to the 3 different regional locations on various days throughout the week. Each of those 3 resources serves 165 people per day, 5 days a week. So Shasta College was previously just doing 165 per day for 5 days a week, and now we have 2 more resources that are doing that much as well. So it should really cut down on the time that it takes for you to be able to schedule yourself to get tested. And then because of the state lab that they have built in Valencia to serve all of these testing resources, the turnaround time has greatly improved already. I think we're seeing maybe 48 to 72 hours turnaround time on test results through the Shasta College site, and it should be the same for those other sites as well.
Thank you, Robin.
I actually just wanted to piggyback off that too, just kind of going back to the testing. I realized I had more questions. Can you just talk to me a little bit, the importance of why people should go and get tested?
Sure. So anytime that somebody is symptomatic or has been around somebody who has tested positive for COVID, and is potentially exposed, they should go get tested so that they can know whether they have COVID or not. Because if so, then they need to make sure that they're isolating as well as notifying any contacts that they've had so that we can contain the spread. The other important reason to get tested is if you work in a setting where you're coming into contact with people. So healthcare workers, as well as people who work in like a retail setting where they're having contact with customers all day, or even coworkers. If you work in an office setting and you're coming into contact with coworkers often, then you should get tested regularly, maybe every couple of weeks or so, just to be sure that you don't have it and that you're not spreading it to others within your workplace.
Follow up on that. So when would be like the best time? Would it be, excuse me, when you're showing symptoms, or when you, like you said, when you know you've had known exposure?
I think both. I think anytime that you have symptoms, it's a good idea to go get tested. But if you had exposure, and I'll let Karen speak to, the timing of when you should go get tested based on when you think your exposure was, but that would be a good time to get tested as well if you feel like you've been exposed to someone who has tested positive or someone who is sick.
Generally, we recommend by the time you've heard from your friend that you were a close contact to them, around that time is a good time to get tested. It's usually about 5 to 7 days after contact, the last contact. We recommend testing, and then again, if we have capacity at the 14-day mark, but generally that 5 to 7 days is a good starting point, and usually that's or soon after you hear from your from your friend who you were exposed to.
Thank you. And I just want to follow up. Dr. Ramstrom, you also mentioned something about the vaccine, and that we've mentioned in the past, Mercy we'll get some of that when it first comes out. Do we know how much now of the vaccine we will be getting, and which one we'll be receiving, whether it's the Pfizer or Moderna?
Sure. So the first push of vaccine that is going to be coming out is the Pfizer, and shortly after that, the Moderna. And again, this access to this again depends on the FDA's approval process. And so, but Pfizer is first, and so it sounds like we're going to be having pre-positioning of close to 2,000 doses. And that should be coming sometime probably in the next week or so. And, you know, then we'll have it. And then once the approval process goes through with the FDA and ACIP meets, then we'll be able to implement use of that vaccine. And then within towards the end of the month, both Pfizer and Moderna will be available for shipment, is my understanding.
The county could possibly be getting both the Pfizer and Moderna.
Yes.
Yeah, and it's probably worth mentioning that really our participation is pre-positioning for what is Region 3 EMS. So that's most of Northern California. So it's not just Shasta County, and it certainly isn't just Mercy Redding. We're just a staging site.
And you mentioned you're a staging site, Robert. So that means you will also be able to possibly redistribute that to other counties that you also intake or serve, correct?
At the request of the state. So it isn't really ours. We're just a holding site. Whoa.
Thank you. I appreciate that clarification.
Hey, Robert, while you're there, what's the situation with the hospitals as far as capacity for COVID patients? And we're creeping above the 60 mark now. Is there a number that we need to be concerned about, that we're going to run out of capacity?
Well, you know, capacity is an interesting thing, Mike. We're a 267 bed hospital. Personally, Shasta Regional, Mark, how many beds?
226.
I was concerned when we got above 10. You know, any number is not a good number. So we have the ability to continue to flex. The higher that number goes with COVID patients, what that translates to is our mutual inability to take care of other types of patients. So what happens is elective cases or less emergent cases get postponed. So when we start talking about how can we impact this disease process, you know, a lot of this just goes back to the social contracts that we have as good community members. So the request to wear masks, to follow hand hygiene, to practice some distancing, just really goes back to the social contract we have with each other, because that's the best way to prevent the spread of this virus. The more that we can prevent the spread of the virus, the less likely we'll have impacts on the hospitals or other businesses, because it's not just about the hospitals. So I know that's a vague answer, Mike. I mean, we have the capability to expand our services for COVID, but those aren't all the best options, right? It's not necessarily how we want to use our hospital. We'd like to continue to do emergent cases for all of Northern California. We'd like to continue doing more elective cases like someone's total knee where they're not able to get around like they need to, or, you know, there's lots of other surgical cases we'd like to be doing, or care that we need to provide.
So I guess my question is there, and this might be for the county, is there a number where we would go seriously consider or set up, you know, the equivalent of the field hospital again? You know, at what point do we do that?
So Dr. Randstrom asked me, we ask this question often. Dr. Randstrom happened to ask me this question not too long ago. We're not even close to that, Mike. We're going to continue to leverage the resources that we have within our walls before we think about any alternative care site. And when I say any alternative care site, that includes non-traditional areas like even our, let's say, an auditorium, where we could, with the guidance of the state and following acceptable practices, we could repurpose an auditorium to care for patients here within our own walls. You know, part of the reason you're going to hear me say we want to avoid having to set up a distant alternative care site is because that splits our workforce. And when we start splitting our workforce, that's where things get much more challenging within any business, but certainly within healthcare. The more we can stay within our own walls, the better.
So it's fair to say we would consider, using one of the auditoriums to accommodate the patients if necessary, rather than going elsewhere.
We will always exhaust our resources internally before we look externally.
Thanks, Robert.
You bet.
We have a couple questions sent in from Donnie Chamberlain from a news cafe. The first one is, how does Shasta County's positive COVID case numbers compare to the rest of the counties? Gavin Newsom mentioned Northern California in his media briefing. Was he talking about Shasta County, and are there any counties with worse numbers than Shasta County? Generally, I would direct you to the shastaready.org website, where on the data and statistics page, you can click on any of the counties in that California map, and it'll tell you exactly what their metrics are. But Robin and Karen, you might have a more thorough answer than that.
No, I don't know the specific rates of all of the counties at this moment, but I believe that we are in the top 5 or so out of all of the counties in the state as far as our case rate. At one point, we were the highest in the state.
Our other question, second of 3, is did Shasta County law enforcement receive any money related to the pandemic? If so, how much, and what was it supposed to be used for? I'm imagining that's probably not on the top of your head either, Robin, but there is the complete CARES funding spending plan is on our website as well. There's the resolution and spending plan at shastaready.org, and then over on the left navigation bar, it's you would click on CARES funding spending plan. But again, of course, I defer to Robin and Karen if you have anything additional. Or Matt, I know Matt, you were involved in that as well.
I was going to say Matt may know more up-to-date information. I know there were some things that the jail was hoping to be able to use CARES funding for, but I think it ended up not meeting the requirements of the funding.
This is Matt. I don't have the latest numbers on that exactly as well, but we will be going back to the board on Tuesday, and we'll ask that staff updates the board on our CARES Act funding, spending, and all that stuff as well. That'll be December 8th, I believe.
All right. And then the third question is, I understand due to HIPAA, you can't identify individuals, but are there notable organizational or business hotspots?
I don't know of any right now. Karen may be able to speak to this as well, but I don't think that there are any big outbreaks going on right now in a particular facility.
Right, I would agree. It's as Robin described earlier, it's sort of everywhere. And some areas, have more numbers, but it's pretty much in all industries, in all geographic parts of the county. So widely distributed.
All right, those are all the questions I have. Do we have any other media questions?
All right, I just have one more follow-up. One more thing. This one's actually for Mark for Shasta Regional. You mentioned 226 hospital beds. Out of that, how many are ICU and how many are regular beds?
So we have 22 ICU beds, so what would that be? 204. Hopefully somebody can check my math. 206 regular beds. So.
Sorry, can you say that one more time?
22 ICU beds.
Thank you.
Other questions?
I had one last question. This is Matt at the Record Searchlight. Just in general, I wonder what your guys' take is on, what's the quick answer for why this is hitting Shasta County so hard now? We had 16 deaths. I'm looking at the state numbers from November. It looks like we reported 16 deaths in November. Contra Costa, which has over 1 million people, reported 15. and we're outpacing them, and they're a lot larger than us. I wonder, what makes Shasta County so special? Is it low mask wearing? Is it low adherence to precautions?
What I could say is I've heard from multiple people who have had experience in other parts of the state or other areas in the country, and we don't have great compliance. We just don't. It's very unfortunate. And I refer back to Robert's, I think, reference to the social contract. We are failing that. And the sad thing is, there's a group of really being safe from the get-go and doing all of the prevention practices and continuing to do that throughout. And then there's the group that hasn't. And I think some people have moved towards doing taking those steps, but there's still a group that are not doing that. And it's unfortunate, and they oftentimes end up in our hospitals. And we also are vulnerable in that we actually have a population that is generally older and does have underlying health conditions, which makes our population more vulnerable to having severe infection should infection occur. And so I think that, we will see down the road as we're able to do more analysis of our data, if that's actually what's contributing. But it's definitely possible. As Robin shared, we're in some of the top rates in the state, and that is not a goal that we should try and achieve. We can turn this around. I know we can, and they're pretty simple practices, as Robert was mentioning earlier: wearing your mask, keeping your distance, hand hygiene, just sticking close to home and family, and not mixing with large groups. Or not mixing with a large variety of people. So I think that we can do better, and I appeal to everybody to try and do that. And I think our hospitals are doing a phenomenal job, and we have calls with them weekly. We're communicating on a regular basis, and I'll tell you, they have stepped up in multiple ways to meet the need in this community. But the people that work in those hospitals are humans, and humans are getting tired. And we only have so many humans across the state that we can actually call on to come help us. And so even though we are managing and doing a phenomenal job responding, that it's definitely taken a toll on individuals. And so I would appeal to people to try and do their part to embrace these prevention measures that are pretty simple to employ in your everyday life.
Thank you.
Any other media questions? All right. Thank you again, everyone, for being here with us today. We will see you again next Wednesday at 11 a.m. Everyone stay safe and healthy.